Hello and welcome. Today we're diving into a rare and complex condition known as congenital auditory nerve malformation, or CAM. This condition affects a crucial component of our hearing, the auditory nerve from birth, leading to significant hearing challenges. Join us as we explore the causes, effects, and management of this fascinating yet challenging condition. The etiology of congenital auditory nerve malformation, simply put, remains complex and often elusive. In many cases, the exact cause is unknown, falling under the umbrella of idiopathic. Genetic factors are suspected to play a significant role. Research points towards possible mutations in genes responsible for the development of the inner ear and auditory pathways during fetal development. Additionally, certain environmental factors during pregnancy, such as viral infections or exposure to ototoxic substances, may also contribute, although these links are still under investigation. A combination of genetic predisposition and environmental triggers is considered to be the most likely scenario in most cases. To understand congenital auditory nerve malformation, we need to consider its pathophysiology. Normally, the auditory nerve, also known as the cochlear nerve, transmits electrical signals from the inner ear's hair cells to the brain, where these signals are interpreted as sound. In CAM, the auditory nerve doesn't develop correctly. This can manifest in various ways. The nerve might be completely absent, aplasia, severely underdeveloped, hypoplasia, or its structure might be abnormal, dysplasia. This malformation disrupts or completely blocks the transmission of auditory information to the brain. The severity of the hearing loss depends on the degree and nature of the malformation. Because the brain doesn't receive the necessary auditory input during crucial developmental periods, it can also impact speech and language development. Because congenital auditory nerve malformation is rare, precise epidemiological data is limited. Its exact prevalence remains uncertain, but it's estimated to affect a small percentage of individuals with congenital hearing loss. Due to its rarity, large-scale studies are difficult to conduct. It is important to note that CAM is often diagnosed when other, more common causes of hearing loss are ruled out, leading to potential underreporting. Further research is needed to better understand the true incidence and distribution of this condition. The primary sign of congenital auditory nerve malformation is profound sensorineural hearing loss, often present at birth. Infants with CAM may not respond to loud noises, fail newborn hearing screenings, or exhibit delayed speech and language development. Older children and adults who are later diagnosed with CAM might experience difficulty understanding speech, especially in noisy environments. Other symptoms can vary depending on the severity and nature of the nerve malformation. In some cases, associated vestibular problems may occur, leading to balance difficulties or dizziness. Diagnosing congenital auditory nerve malformation requires a comprehensive audiological evaluation. This typically includes otoacoustic emissions (OA) testing, which assesses the function of the inner ear's hair cells. Auditory brainstem response (ABR) testing is also crucial. This test measures the electrical activity of the auditory nerve and brainstem in response to sound stimuli. If the ABR is absent or severely abnormal, further imaging studies are usually performed. Magnetic resonance imaging (MRI) is the gold standard for visualizing the auditory nerve and inner ear structures. This allows clinicians to identify any malformations, such as absence, underdevelopment, or structural abnormalities of the nerve. Genetic testing may also be considered to identify any underlying genetic mutations. While a universally accepted classification system doesn't exist, congenital auditory nerve malformation can be broadly categorized based on the severity and type of nerve malformation. These can include complete aplasia, absence of the nerve of, severe hypoplasia, a significant underdevelopment, or dysplasia, abnormal nerve structure. The location and extent of the malformation can also be used to further classify the condition. Such a classification allows doctors to determine the best treatment method to prescribe to the patient based on the severity of their malformation. Currently, there is no cure for congenital auditory nerve malformation. Treatment focuses on managing the hearing loss and supporting speech and language development. Hearing aids are typically not effective because they amplify sound, but don't address the underlying nerve problem. Cochlear implants, which directly stimulate the auditory nerve, can be beneficial in some cases. However, the effectiveness of cochlear implants depends on the degree and nature of the nerve malformation. Auditory brainstem implants, ABIs, are an alternative treatment option for individuals with absent or severely underdeveloped auditory nerves. An ABI bypasses the auditory nerve altogether and directly stimulates the brainstem. Speech therapy and language therapy are crucial for helping children with CAM develop communication skills. Educational support and counseling can also help individuals and families cope with the challenges of this condition. As congenital auditory nerve malformation is, by definition, congenital, primary prevention isn't currently possible. Genetic counseling may be helpful for families with a history of hearing loss or known genetic mutations associated with inner ear development. Prenatal care and avoidance of known teratogens during pregnancy can help minimize the risk of some environmental factors that may contribute to the condition. Early detection through newborn hearing screening programs is essential for early intervention and maximizing developmental outcomes. The prognosis for individuals with congenital auditory nerve malformation varies depending on the severity of the malformation and the effectiveness of treatment interventions. Early diagnosis and intervention are crucial for maximizing speech and language development. Cochlear implants and ABIs can provide some level of hearing sensation, but the degree of benefit varies greatly. Ongoing research is exploring new approaches for stimulating the auditory pathway and improving hearing outcomes. Gene therapy and stem cell therapy are potential future treatment options, but are still in early stages of development. The focus is on providing comprehensive support and resources to help individuals with KM live fulfilling and communicative lives.